My biggest fear is not getting better. Like I said before, this isn't any way to live. Inside, when these symptoms are happening, they're scary. They you feel like you're dying sometimes.
All right, well, that was Teresa Smith back in August talking to ABC4's Rosie Nguyen about the long-term effects of COVID-19 that affect her months after the virus cleared from her system. Welcome back to our In Focus topic. It's COVID-19 long haulers. Now, there's more data about how the virus affects people, but we are still learning about the impact the pandemic will have on us. One thing doctors will study is how to treat people who have long-term effects after getting COVID. Now, this is a fascinating topic. Joining us now to talk about it all, being a long-timer himself, is Tanner Olson. Tanner, thank you so much for being here.
You bet. Happy to be here.
All right, so we just off camera chatted, and you said this is one of the hardest things you've ever been through.
Easily, for sure. I've never had any major sickness in my life, and so this definitely hit me like a train.
Okay, so let's start back at the beginning. When did you contract COVID-19, and then what was your experience after that? I want to hear what the initial symptoms and all of it was for me too.
Right around 4th of July weekend, thought I just kind of had a common cold. Normally, I'm a huge runner, and so I even kept on running throughout that first week, thinking I could just run my way through every cold like I've done in my life. And by the end of that first week, thought I was through it until I went on a run, and heart rate obviously went up running and then never came back down, and that's when I knew that something was probably pretty wrong.
So then you went and got tested specifically for COVID, or what was the testing process like?
Yep, went and got tested the next day, and then just kind of had to wait things out. It took like 5 or 6 days to get tested, and went to Instacare, and then the symptoms from the first week versus the week after that were night and day different. Then all of a sudden I was having brain fog and heart rate issues and all kinds of crazy things.
And as you said, like, you're pretty healthy. You're physical, you do a lot of physical activity. So was this just pretty flooring to you to see that you weren't the typical person to have such severe symptoms in a way?
Yeah, I mean, I think like most people my age, I think we all thought that we're young and healthy, and it's no worse than the flu. How bad could it be? And so, I figured I'd power my way through it. Thought I was in for 14 days at the worst case scenario. I was running 65, 70 miles a week before I got sick. Nothing better to do during a lockdown than start, up my mileage.
Right.
And haven't ran really since.
Oh my goodness. So real quickly, I want to know too, you have some photos that are showing here of how active you are. Some of those look like it might be brothers. Were those brothers? Has anybody in your family had COVID and had same experiences, I should say?
Luckily, no one in the family has,
okay.
But definitely plenty of close friends that are my age, and a few having long haul symptoms just like me now.
Okay, so speak to those long haul symptoms that you're having.
So the most prominent one is dysautonomia, which most people have never heard of, so look it up if you ever get a chance. But basically, when I stand up, my heart rate will shoot up well into the 100, 120. Those first few weeks, it was hitting 140, 160 range just because of standing. Walking, it would go even higher, and then, any other given symptoms of just sitting on the ground or lying down, I'd have a high heart rate for no issue or for no reason at all. There were times where I was walking and I felt like I was drunk or stumbling for no reason, trouble remembering things, just constant chest pain. Struggling to breathe throughout most of the day.
Some scary symptoms.
For sure.
You even gave up beer and coffee because of the high heart rate issue.
Yes, unfortunately, I haven't had a beer or coffee in 5 months now, and can't wait to have a cold one here soon. But
it tells you how bad you're feeling if you're willing to give up some of those things, right?
I know. I was a 3-cup of coffee guy per day, so definitely jonesing to have my first one.
Most definitely. Okay, well, tell us real quick how you found the Utah COVID-19 Long Haulers group and how it's impacted you and your life since.
My grandmother sent me, the University of Utah was hosting a long haulers kind of Zoom group that we could all hang out, talk about our symptoms and kind of get through it together. And then Lisa, being one of those members, told me about the Facebook page and joined it. And it's a phenomenal resource just to have other people that kind of empathize with what you're going through. people talking about what their symptoms are, what's helped them get through certain things, and honestly, it's just nice to know that you're not in the fight alone, and there's, I mean, now over 1,000 people fighting the same fight with us just in the state of Utah.
Right, you're not alone. All right, they've told me to wrap up, but I do want to ask you this final question. What would your message be to the community tonight? What do you want them to know about these COVID-19 long haulers as yourself?
I think specifically for my age group and my peers that are, 5 years, 10 years below me, I think
all right, and you're upper 20s, 28, right?
28,
Makes that
yep.
clear.
And so I think we all thought that, for us, the worst thing that can happen is you just get the common cold or you get a flu and you get over it. But no, it can hang around for 5, 6, 7, 8 months. And, who knows how much longer until I'm back to where I was before COVID.
Right. Tanner Olson, thank you so much for joining us, being here, sharing your story, showing yet again that this definitely is real and can impact any one of us. Thanks again, Tanner.
You bet. Thank you.
And I just knew that if I was going to get Utah to listen to me and see that this was going on, that I was going to need to find the others. I also wanted to create a group for more local support.
All right, Lisa O'Brien back in August talking about her then newly formed group, Utah COVID-19 Long Haulers. Well, a lot can happen in just 4 months' time, especially with cases spiking over the past few months. Now, there have been many hospitalizations and deaths since August, and most likely more people experiencing long-term effects from this virus. So to give us an update on these people, joining us again is Lisa O'Brien, who founded the group Utah COVID-19 Long Haulers. Lisa, thank you for joining us. We were just talking off camera how important this discussion really is.
Yeah, thank you so much for having me back.
So let's start off right at the beginning. How was your group formed, Utah COVID-19 Long Haulers, and how has it grown since its establishment?
So I started it back in June, and at first, it slowly grew over the last several months, but it's really picked up since then. We just reached over 1,000 members a few days ago, and last month we actually had about 500 new members join. So we had like a 96% increase just in November.
Wow, so let's talk about the demographics, about the people who are a part of this support group that thankfully you set up for everyone.
So we're seeing predominantly more women in our group. There's only about 20% men. The average age range is about early 40s, but we do have younger people in our group, and we have older people in our group too. And so yeah, it's predominantly women.
I find that interesting though. So is everyone a part of the group someone who's experiencing these long-term effects, or a family member of someone who's experiencing some of these long-term side effects?
Yeah, most people are experiencing them, but we do have family members. So some people don't have Facebook, so their wives are in there, or caregivers of long haulers. It's a tough job, and they want to know all the answers and everything that we know. So.
Right. Okay, so you've been a really rigorous advocate for COVID-19 long haulers. Tell me about the advocacy work you've been doing in the past few months to raise awareness, to educate those out there, all things on those terms.
Well, most recently, we've just teamed up with researchers at the University of Utah, which is really exciting. I've also connected with some of the doctors at the Bateman Horne Center, who are basically experts in post-viral syndromes. We've worked with some doctors at IMC who have gone on to teach some of their general practitioners about some of the symptoms that we're experiencing, so they know what to look for when long haulers come into their clinics. And a few months ago, we actually got to present during the U of U's Project Echo webinar, and I think we presented to over 100 doctors. Wow. Kind of a strange time in my life when I'm actually teaching medical professionals what's happening to me.
I was just thinking that here you are, this impacted you, and now you've created this movement of education in a way. Would you ever have predicted this would be where you are, I don't know, a year ago?
No.
No.
Not at all. Not at all.
Incredible. So tell me again, social media obviously has played a big role in your advocacy and your networking. How do you want people to use this, and how are you using this?
Yeah, social media has been awesome, especially, you know, to find all the other long haulers and to have this group. But I've also been in the larger support group since April, and so I've made a ton of connections, not only just in our country, but outside of our country too. And I have a lot of friends, and Twitter has been so resourceful. I actually found one of my cardiologists on Twitter. And I've, you know, befriended a lot of virologists and researchers, and there's just so much good information being shared on Twitter.
Can you tell us just really briefly, I don't want to focus too much on this, but what are some of the symptoms that you're still experiencing? Yeah,
so I am still having issues, like cognitive issues. So I'm forgetting words, or I'll mix words up, or sometimes I'll just be talking and completely like lose everything in my mind, which we all do sometimes, right? But this is happening to me like daily. And then I'm dealing with what they call post-exertional malaise, which means that if I overexert myself, it can just wipe me out. And sometimes I need like a day or two to recover from that.
My goodness. All right. Very distinct symptoms there. Okay. Last question. I know we have to wrap, but what are you optimistic about? Do you think there's hope out there with all of this?
Yeah, I do. You know, just like Tanner said, knowing that we're not alone, having the group, that's so important. And then, you know, all this research that they're going to get started on, like I'm really hopeful that we're going to find some answers that will lead to treatments, not only for long haulers, but for even others who have struggled with these post-viral illnesses for decades.
All right, again, for people who are interested in getting connected, it's Utah COVID-19 Long Haulers, right?
Yeah.
On Facebook.
Yeah.
Okay, thank you. Lisa O'Brien, founder of the Utah COVID-19 Long Haulers Group. Again, thanks for joining us and for all the work that you've done and for taking your time to talk to us tonight.
Thank you.
For an individual, it's an opportunity to take an unfortunate circumstance, which is being diagnosed with COVID-19, and use it to put a positive impact on all of our community.
All right, that was Dr. Sarah Majersnik announcing on Wednesday that Utah is participating in a national study for long-term effects of COVID-19, specifically blood clotting. Now, one overlooked aspect of the impact on healthcare that the virus has caused has been the research onto the disease. Doctors and researchers are constantly looking at the virus and its impact, and the more we learn, the better equipped we are to battle the pandemic, of course. So joining us now in studio, Jeanette Brown, Assistant Professor for Internal Medicine at the University of Utah, and John Inadomi, the Department Chair for Internal Medicine at the University of Utah. I cannot thank you both enough for taking time out of your night tonight to talk to us. Thank you. And we'll start right off the top. Jeanette, what do we know so far about COVID-19 long haulers, I should say?
So we know that patients experience symptoms now for weeks. The exact percentage is unclear. Different studies will tell you different numbers, but some estimate as low as 11% weeks later, and up to 35 or 40% of patients are still experiencing symptoms weeks into their illness.
Wow. Okay, so that's some of the things we do know, but what do we not know yet about COVID-19, and what new information we'll be looking to find in research, I should say?
So one of the things that we don't know is what are the causes of these illnesses. Are they from the virus itself? Are they from the immune system's response to the virus? One of the things that we're looking forward to being able to doing is having a biorepository, which is basically a collection of samples, be blood, be sputum, be saliva, to be able to go to when a researcher or a doctor has an idea and be able to shorten the amount of time it takes to do the investigation to get better answers.
And tell us too, John, what more would you add to that as well?
Yeah, well, thanks so much. I think that the symptoms that Tanner and that Lisa had talked about were very common. It's amazing how these young, really healthy people have these devastating long-term consequences. The other unusual symptoms, things like loss of taste or loss of smell, and tinnitus, this ringing in the ears. And there's some newer symptoms such as visual hallucinations. So these things are truly remarkable, and this virus really does surprise us every day.
And that's what I'm really interested in. Before we came on camera, we get to have a hot second of just some chat. You were telling me that this is something that, yeah, we are surprised by every day, that there's no real pattern to it yet, which is what makes it so fascinating.
Right. I think a lot of it is because we just don't understand the etiology, the cause of these long-term symptoms. Now, you talked about blood clots. We happen to have a great deal of expertise in understanding clotting disorders. And that could be a major cause of some of these issues related to the brain, the kidney, the heart, and the lung.
Wow. Okay. I do have a couple of friends, actually, family members who've had the loss of taste and smell, and then a friend who just talked about this consistent brain fog that hits at the same time every day and has been for weeks now. Just absolutely fascinating. So moving on, though, we don't know what the trigger for long haulers is, though, or do we know a commonality for them all? And well, Jeanette, will go to you, and then John, we can answer, and both of you, please answer.
So far, we have not found a commonality. We have definitely seen these symptoms in all age groups, but it's surprising that many of these patients had what we would consider relatively mild initial illnesses, but then as time developed, then they felt more ill and new symptoms kept popping up, or as Lisa had highlighted earlier, they kept changing. So it's been really challenging for these patients. One particular study out of Indiana University was an open survey where they allowed people to write in their own symptoms, and that was particularly fascinating because people added in things that researchers may have not been looking for to begin with.
Wow. And John, do you have anything to add to that?
Yeah, you know, we have been very successful in obtaining funding from, let's say, the NIH or the VA or the DoD, but mainly about the acute infection of COVID and the consequences and treatment. But this whole field of the long haulers is so new, we don't know enough. And that's why the stories that, let's say, Tanner brought to us, I really applaud his courage for bringing that to us. And Lisa, that's the credible work she's done to provide the support. But this is the kind of research we need. And to get the pilot data to then be able to develop a really good hypothesis that could then be submitted to the NIH is what we really need to do now.
Most definitely. So Jeanette, real quick, what's the percentage of COVID patients that, oh, you know what, I'm going to move, that are ending up with COVID-19? The long haulers, those long haulers. What percentage of those that have COVID-19 are having these long haul effects?
We don't know just yet because there have been some studies that have come out, but the virus honestly hasn't been around that long to know that exactly. It depends on the population that you're surveying. But yeah, it still needs to be figured out.
Again, still so new.
Yep.
Okay, so let's move to the study. John, tell me why you need funding for the research, and you're asking for donations from the public, right?
Sure. And you may say, well, why don't we just do it ourselves? But again, we're pretty well funded to look at the acute condition of COVID-19. But what we do need right now are the pilot data. You almost need data to get more data. Mm-hmm. And at this point, we're such at the infancy, we really need the help of people like Tanner, like Lisa, and the folks in the audience who have these symptoms to be able to provide a registry to understand what their symptoms are and to follow long term. And by getting some of these data early, and let's say getting some tissue or blood to be able to understand what's going on biologically, that'll really help us. And using those data, that we can go to much bigger institutions to get more permanent funding for our research.
Okay, this is just, again, something we could talk about for probably hours. Can I get your final thoughts from both of you? Again, there is probably so much you want to say, but if you had one last message you want to share with the viewers tonight, what would that be? Jeanette, if you'd like to start, and then we'll go to you, John.
Yeah, so we're in the preliminary phases of putting together a post-COVID clinic to be able to follow patients both for treatment, but also to provide them access to the latest research and treatments themselves and opportunities to participate in research studies.
All right, thank you, Jeanette. And John?
Yeah, just briefly, again, COVID-19 is deadly. And if it isn't deadly, you can see now the long-term consequences of people who survive. And it's highly preventable, but what you do protects others, what others do protects you. So, mask up, Utah, make sure you socially connect, but physically distance. You got to wash your hands and, make sure that you take care of yourselves and the people around you.
I appreciate those hand gestures and those reminders. I think if anything, this discussion this evening shows just how real this is, even if the large percentage isn't the long haulers, but really to know that anybody could be a long hauler is something we really should take in mind to protect one another. Thank you, Jeanette Brown, John Inadomi from the U of U Health. Thank you again for being with us on our show this evening.